Dear students and my dear viewers, welcome back. In this video we are going to discuss about the urinary system parts, which are the important structures present in the abdominal region. Okay, in this video we are going to discuss about what are the structures or the organs present in the urinary system, and we are going to discuss about the kidneys in this video. That too, we are going to discuss about where the kidneys are exactly located, what are its shape, size, weight and orientation, and what are the external features of the kidney. Okay, now we will move on to what are the structures present in the urinary system. First of all, we should know that this urinary system is one of the basic life processes system which is present in our body, and this urinary system includes a pair of kidneys. One is right kidney and the left kidneys, which are actually present or situated on the posterior abdominal wall on each side of the vertebral column, and from the kidneys a pair of ureters are present, which also present on the posterior abdominal wall, and then these ureters are opening into the urinary bladder, which is present on the anterior pelvic cavity. This is the urinary bladder, and which is located on the anterior pelvic cavity. If you see the overall functions of these organs, the kidneys are mainly used to remove the waste products of the metabolism, and it maintains the pH, and also it removes the excess of water and salts from the blood. If you see the ureter, this ureters or the tube-like structures which conveys the urine which is formed in the kidneys or transported to the urinary bladder, where the urinary bladder is a muscular organ, and which is commonly called as temporary reservoir of the urine. So, and the urine is expelled through the urethra, which is the terminal part of the urinary bladder, and the urethra is controlled by an external sphincters. So these are all the structures which are present in the urinary system. First of all, we are going to discuss about the kidneys. Okay, yes. Here comes the kidney. Yeah. So kidneys, if you see the other names, synonyms of the kidneys are called renus. So renus is also called as a renal. From this word only the renal word is derived. Okay. And if you see the definition of the kidney, these are the pair of excretory organs situated on the posterior abdominal wall on each side of the vertebral column. So here if you see this, here you can find the vertebral column on the posterior aspect, and these are the retroperitoneal organs. So the kidneys are the retroperitoneal organs. So the main function of this kidneys are they remove the waste products of the metabolism and excess of water and salts from the blood, and it also maintains the pH. Okay, so the main function is its formation of urine. Through this urine only the waste products are excreted out. If you see the location of the kidneys occupies epigastric hypochondriac, lumbar and umbilical regions. So we have already discussed earlier in the regions of abdomen. So the lines or the planes which divides the abdomen or the transpyloric plane, so which cuts or passes through the tips of the ninth costal cartilage and posteriorly through the body of the L1 near its lower border, that is the transpyloric plane, whereas the another plane is the transtubercular plane, which passes through the tubercles of the iliac crest and the body of the L5 vertebrae near its upper border. So these are the two transverse planes, and also on the right side and the left side will have the mid-clavicular lines, right lateral plane and left lateral plane, which cuts at the level of the mid-inguinal point. Okay, so with these forms the areas. One is on the left, on the upper side, on the upper three segments or the upper three areas or the epigastrium, that is the middle part, and the left hypochondrium and the right hypochondrium, left lumbar region and the right lumbar region, and at the middle you'll have the umbilical region, and below this umbilical region you'll have hypogastrium. On either side, right and left side of the hypogastrium will have the right iliac fossa and the left iliac fossa. If you see the location of the kidneys, so I have brushed up this regions of the abdomen. So now if you see the location of the kidney, this kidney is located in the regions of epigastric. So this one is the epigastric region, so the part of the kidney which is present in the epigastrium, and also hypochondric. So these are the hypochondric regions, right and left side of the hypochondric regions, and this one is the umbilical region. Okay, and you'll have the some part is also present on the right lumbar as well as the left kidney is located on the left lumbar region. So these are the regions: epigastric region, hypochondric regions, umbilical regions, and the lateral lumbar regions occupies the kidney. This is the location of the kidney. Okay, vertically they extend from the upper border of the 12th thoracic vertebrae to the center of the body of the 3rd lumbar vertebrae. So here on the upper border you'll have the 12th thoracic vertebrae, T12 to L3. So these kidneys are located in between these two vertebrae. Okay, and also the right kidney is slightly lower than the left kidney, and the left kidney is little nearer. So the left kidney is little nearer to the median plane than the right. Okay, and this transpyloric plane, which passes through the upper part of the hilus in the right kidney and the lower part of the hilus in the left kidney. This implies the orientation, how this kidneys are located. So by seeing this thing, we can easily identify that the right kidney is somewhat located lower than the left kidney. Why? Because on the right side the liver occupies most of the space. So because of the liver, location of the liver, the right kidney is located somewhat at the lower level than the left kidney. Okay, now we will move on to the external features of the kidney. Yes, here you can see the transpyloric plane. Here on the right kidney, it is located on the upper part of the hilum. If you see on the left kidney, which is located on the lower part of the hilum, this plane. Okay, now if you see the external features, each kidney is about 11 centimeters long and 6 centimeters broad and 3 centimeters thick. 11 centimeters long and 6 centimeters broad and 3 centimeters thick. The left kidney is a little longer and narrower than the right kidney. Okay. On the average, the kidney weighs 150 grams in males and 135 grams in females. The color of the kidneys are reddish brown. Okay. Now, if you see the long axis of the kidney is directed, so the long axis of the kidney, if you see this, the long axis of the kidney is directed downwards and laterally, so that the upper poles of the kidney are nearer to the median plane than the lower poles. Here if you see, the lower poles are somewhat far away when you compare with that of the upper pole. Upper poles are very much nearer. So the upper poles are 2.5 centimeters. The upper poles are 2.5 centimeters away from the midline. If you see that the hilar region, it is 5 centimeters away from the midline. And if you see at the lower pole, it is 7.5 centimeters away from the midline. Okay, and also the transverse axis is directed laterally as well as backwards. Because of this axis, the kidneys are slightly tilted towards anterior as well as backwards. So what will happen, due to this tilting, the hilum are present more anterior than the lateral borders. That means the hila is present more anterior than the lateral borders of the kidney. Okay, so this is about the what you call it as the orientation of the kidney. So, and if you see the other external features, the kidney is bean shaped. And it is having two poles. One is upper pole and the lower pole. So this one is the upper pole and the lower pole. And also it is having two borders. One is the medial border and the lateral border. And two surfaces. One is the anterior surface and behind you can have the posterior surfaces. So the kidney is bean shaped. It is having two poles. One is upper pole and the lower pole, and two borders. One is medial border and the lateral border. And it is having two surfaces. One is anterior surface and another one is posterior surface. Okay. Now, if you examine the poles of the kidney, so the upper pole is broad. And it is in close contact with the corresponding suprarenal glands, and it is corresponding to the suprarenal glands. If you observe the lower pole is pointed. This is about the poles of the kidney. Now, we will see the surfaces of the kidney. One is the anterior and posterior surface, and the anterior surface is said to be irregular. So the anterior surface is irregular and the posterior surface is flat. The posterior surface is flat. So it is often very much difficult to recognize the anterior and posterior aspects of the kidney by looking at the surfaces. Okay, and if you want to identify the surfaces, you should know that what are the structures present in the hilum. So based upon the structures which are passing through the hilum, we can distinguish the kidney's surfaces, whether it is an anterior surface or a posterior surface. Okay, now if you see the borders, one is the medial border and another one is the lateral border. So the lateral border is convex. The lateral border is convex. And the medial border is concave. The medial border is concave, and in the medial border it is having a depression. That depression which is present on the medial border of the kidney is called as hilus or hilum. Okay, there is through this hilum. Hilum is the opening for which the blood vessels and the nerves passes through the kidney. Okay, now we will see the structures which are passing through the hilum. Okay, yes. So this is the right kidney and this one is the left kidney. What are the structures which are passing through the hilum? This is the hilum. So here you have to remember that the structures which are passing from anterior to posterior side. So this one is the anterior surface. So the first structure which is passing through the hilum anteriorly is the first one is the renal vein. So first structure is renal vein, and behind the renal vein you'll have the renal artery. Next one is the renal artery, and next one is the renal pelvis. So here you can see behind this renal artery you can find this pelvis, renal pelvis. So the renal pelvis is nothing but the expanded upper end of the ureter. The expanded upper end of the ureter. So what are the structures which are passing through the hilum from anterior to posterior? The first one is the renal vein, and the next one is the renal artery, and next one is the renal pelvis, which is nothing but the extended part of the upper end of the ureter. By examining these structures, which helps to distinguish the anterior and posterior aspects of the kidney, and also the site determination of the kidney, whether it is a right kidney or left kidney. So these are all the structures which are passing through the hilum. And another important thing is, so the renal artery is having 5 branches. So out of 5 branches, 4 branches are passing anterior to the renal pelvis, and only 1 branch which is passing posterior to the renal pelvis. So this one you have to remember, and this thing we are going to discuss in the vascular branches and also vascular segments of the kidney. Okay, so this is all about the external features of the kidney. In the next session we are going to discuss about the surface anatomy of the kidney. Thank you.